Ever wonder what a medical coder does? I'm going to show you in this video. Hey there, I'm Victoria Mull, and today I'm going to tell you what a medical coder does. Now, a lot of people are interested in this career field, but they don't know where to start, and that's where I come in. I'll explain some of the basics of medical coding and even what the day in the life of a medical coder might look like. And of course, we're going to talk about the importance of medical coding in healthcare, so let's get into it. So a medical coder is responsible for reviewing medical charts, medical information, all those medical terms, and then translating them into different code sets. There's code sets for diagnoses, there are code sets for procedures, for surgeries, for drugs, all kinds of different things that we want to collect that data on. And anyone, regardless of their age or their gender, can become a medical coder. Most of the jobs in medical coding are day shift hours, and there are a ton of remote work opportunities. You do not need a medical degree, you do not need clinical experience, but you do need to know some medical terminology, some medical concepts, which I'll talk about more towards the end of the video. Medical coding is a vital role in the medical industry. We want to make sure that everything that is being done to the patient is told in a story through these codes. That makes sure that patients' bills get coded appropriately and that they get paid appropriately through their health insurance. And it also takes all of those different medical diagnoses, the services that are rendered, the drugs that we're using, and classifies them into codes that can be filtered, they can be sorted, they can be reviewed, analyzed from a data perspective. And then we can filter that data and use it for things like tracking treatment progressions, tracking disease progressions, or even things like budgeting for future healthcare costs. Now, coders work a lot with code books, or sometimes they have software that is the equivalent of the code books for the certification exams that you need to become a certified medical coder, which is what most employers want, a certification through AAPC or AHIMA. You need to use the books for your certification exam. A lot of coders really like the books, but there are equivalent software packages that you can purchase or that your employer might give you when you're working as a medical coder. And there's also lots of edits and different tracking and notifications that can be programmed into an electronic medical record to kind of help you out. Think of when you're like online shopping and you punch in your credit card number, but maybe you fat finger the expiration date and something will pop up and say, hey, this card number was incorrect, and it alerts you to change it. It doesn't know what to change it to. You have to have that human intervention to determine what the appropriate corrective manipulation is going to be. So because there is just such an increasing complexity and an increasing consumption of healthcare in the United States, there's always going to be a need for medical coders, even though there's a lot of automated assistance that is being implemented and actually has been used in the industry for as long as I've been in the industry, well over a decade. So a medical coder has to stay abreast of a lot of these changes. The codes change every single year. They add new ones, they delete some, they revise them. And insurance coverages change. So not everything is going to be covered by your health insurance. They might have certain things that they'll cover for certain reasons. Take the example of a patient who needs an EKG or an electrocardiogram, which does the recording of the electrical signals of the heart. So an insurance might only pay for an EKG if there's a related heart condition, if the patient's having a heart flutter or they're having chest pain. So they'll program their systems that pay for those claims when they see, oh yeah, this patient had an EKG and it's this code, and oh yeah, they had chest pain and it's this code, that's something we're going to cover for. If they see that EKG and they see a diagnosis that has foot pain on it, they're going to go, you know what, that doesn't seem correct, we're going to deny that claim and have them maybe take another look at it. So the insurance will have everything programmed that'll say, hey, for these EKGs, we want to see heart-related diagnoses, not a diagnosis for toe pain. That doesn't seem medically necessary. It's really important for medical coders to be able to work quickly, to be able to work efficiently, because there's just a lot of information that they have to process. There's a lot of reading and analyzing that goes into medical coding, a lot of reading. So if you're interested in this position, understand that it's going to be a lot of sitting down, or if you have a stand-up computer, standing up at your computer, reading through a lot of charts. Almost all medical coders have some sort of productivity and accuracy rates that they need to hit. It's a really very focused, sort of detail-oriented position, which is why a lot of employers have implemented stricter regulations for remote employees than you may see elsewhere. Also because of, privacy of health information, we have to make sure that people aren't sitting in, a Starbucks and they have their laptop open and there's pictures of patients' bodies on them or their medical record information. Oftentimes employers will have regulations that younger children have to be in daycare or being taken care of by another adult, that you shouldn't be taking care of your child while coding records, because you have to be able to focus on all of those details to make sure that you're coding accurately. Otherwise, it could really impact reimbursement. Patients could wind up with getting their bills denied, and then they're calling up, the insurance companies, they're calling up their healthcare organizations, and they're very upset. And some of these patients have very, very sensitive medical conditions, and the last thing they need is all that frustration because things weren't coded or billed correctly. And there are certain times where medical coders may have a heavier workload, oftentimes maybe the end of the month, or if you're working for an organization that maybe takes on a new practice, that they're bringing them on and taking over their billing, or they're just joining a larger healthcare organization and maybe they have like a backload of billing that needs to get done. Most medical coders work full-time. There are part-time opportunities. It's not unlike pretty much any other industry. You'll find some that are very, very flexible employers. You'll find other employers that are very strict. So I can't really give a straight yes or no answer as far as questions like, oh, well, am I going to be able to stop and pick up my kids and then go back to work? Because that really is employer dependent, not industry dependent. So most medical coders spend the majority of their day reviewing medical records, assigning the diagnoses, submitting them into the billing system. Sometimes things will get kicked back by the billing system. They might have to review it. Some coders review denials. Like, let's say, going back to our EKG example, if we get that denial that the insurance company says we're not going to pay for an EKG for toe pain, that might go back to a coder for them to review and go, oh, you know what, someone fat fingered it. They transposed some numbers, or I don't know what the heck happened, but the right diagnosis was on here. They must have just put the wrong code on, maybe they selected it wrong. So there might be coders that do reviews as you go on. There's a lot of different ways you can grow into medical coding. You can go into compliance, you can go into auditing. The average medical coder, someone who works in the capacity of medical coder, on average makes about $50,000 a year. Now it is a little bit less to start out because that is the average. But what I would highly, highly recommend you do is you can check out the AAPC salary calculator. I will link it in the description below. And what you can do is put in your location, what credentials you're looking for, and they'll give you some information about some of the salary ranges for that credential and your location and all kinds of really useful information. There's a lot of online resources to learn medical coding. You can check your local community colleges or training institutes. You can go to aapc.com. But what I really, really recommend you do is sign up for my free masterclass, because it will basically outline for you all of the things that you want to do to be successful as a medical coder. Like, how do I go from someone who's like, oh, I'm looking into this, to how do I be job ready as a medical coder in as little as 6 months without going into student loan debt. It's everything you need to know to get into the industry right away. It's like the full roadmap on what you need to look out for, what credentials you want to get. It just makes everything so much easier. And as part of the masterclass, I tell you about the premier program that you need to get into that will absolutely get you ready for a career in medical coding, prep you for the CPC exam, which is the most sought after medical coding credential. So if you want more information on how to become a medical coder, definitely check out the masterclass linked in the description below. And if you just want some more information about how to get started in medical coding, just in general, I have a whole playlist on that you can just binge watch at your leisure. I will see you guys in the next video, and until then, just keep on coding on.